We're gonna play it from the start. So today, I'm Dr. Stephanie Kane. I am a foot and ankle specialist here in South Florida, and today we're going to be talking about skin conditions of your feet. So just some quick facts about your skin on your feet. The plantar skin, which is the bottom of the foot skin, it actually lacks certain glands, which are called sebaceous glands, and so that can lead to dryness. That can lead to fissures, which are thick kind of like depth in the dry skin. Those can crack, those can become wounds, or they can bleed or be really painful for you. There's so many layers that make up your skin, and a single square inch of skin has about 300 sweat glands, and a lot of those are in the foot, and that's why we see a lot of these conditions because of the warm, moist environment that the foot kind of holds. The toughest skin is on the bottom of the foot. The first layer, the epidermis, that's about 1.5 millimeters thick in the bottom of your foot. It's about 3 times the thickness of the same skin on the eyelids. So that's why you have that protection on your foot. It protects your whole body, protects your feet from when you walk. But a lot of things can happen when we kind of put a little extra pressure on those feet. One of the most common things that I see is patients coming in saying that they have a corn, and everyone's kind of heard the word corn, but they really kind of want to know what it is, or why it's causing them pain or discomfort, or why it is where it is. Corn is just a thickening of the skin, and usually it's on the toe or in between the toes, and they're usually just found because of pressure or friction to the area. So a certain shoe, or maybe a hammer toe deformity that kind of rubs a little bit on the ground or in the shoe, or sometimes when the toes kind of overlap each other, they can get corns in between. It's super common. They usually have a deep central core to them. So it's not just a thick of the skin. They start to kind of core into the skin, and they can kind of feel like a pebble in there, or it can kind of feel like a little indentation in there. When they're found in the digits in between the toes, they're commonly called a kissing lesion, because you'll get it on one toe and the other toe together. One may be worse than the other, but those are like kissing lesions because they're touching each other and the bones are rubbing, and they're kind of developing a corn there. Unfortunately, sometimes bacteria and fungus can kind of get into that corn area and infect the area. So if not treated, then it can lead to further complications. But usually it's just a thickening of skin with no complications and no issues. So causes of the corn and prevention. So constant pressure to the area will cause the increase in tissue, which will lead to a corn. So we want to make sure that we're wearing good shoes, wide toe boxes that are, if we need toe spacers, that our toes aren't, rubbing and touching each other. We want to space them out from each other. If the toe box is too small or too tight, we talked about shoes last time, you can lead to corn development. Sometimes it is the deformity of the hammer toes or the foot, and a doctor may talk surgery with you, but mostly it's usually conservative care. That activity and pressure, if you do a lot on your feet, it builds up that tissue there, and it can build up that corn. It can build up pain, discomfort. And a lot of times there's bones that stick out a little bit more than others. As we get older, we lose some of our fat pad in our foot. We can have bone spurs that stick out, or maybe we had a fracture at some point and that fracture healed, and a little bony overgrowth in that area. And that puts some extra pressure to the skin on the outside from the inside, and that can cause a corn or any kind of callus formation there. So really, to prevent the corns, the doctor may shave down the lesions when you see the doctor. The wearing good shoes, not too tight, wide toe box, nothing that puts pressure on certain areas that you may be prone to developing corns. Corn pads, which are little candy pads with holes in the middle. If you go to the pharmacy, you're going to see ones that have medication versus not medicated. The non-medicated ones are the ones that are going to prevent kind of it from coming back. And drying between the toes is really important too. When you get those kissing lesions with the corns between the toes, sometimes they can stay wet and moist, and then that can foster an environment for fungus or bacteria. So if we do have corns, although they're usually very common and not a big thing for a lot of people, it is still good to see a doctor and kind of get an idea of what's going on and kind of get them smoothed down for you. A callus. So a callus, a lot of people confuse the two together. A callus is a thickened area of tissue. Usually it's on the bottom of the foot. That's the most common spot that we kind of see it because of the decrease in the plantar fat pad, because the metatarsal head. So the metatarsal are the long bones in the foot, and you can see the shape that they have, a little rounded head. They put a little extra pressure On the first metatarsal, you have these two bones called the sesamoid bones, and they add a little bit of extra pressure. So we see a lot of calluses in the forefoot, and it's usually due to the pressure, the biomechanical, meaning your gait, the way you put the pressure on your foot. It's just like a corn. It's an area of thickened tissue. It usually is on the bottom of the foot, like we just discussed. And usually, honestly, the first line of treatment is padding. The doctor may also shave it down, give you some help, some creams to the area. Something called urea, UREA, is a good cream. It's what we call a keratolytic. So it does eat away at some of that dead tissue and kind of helps decrease the time that it comes back. I tell a lot of my patients I'll shave them down their calluses, and sometimes I won't see them for months at a time. Sometimes I'll see them in 3 to 4 weeks and we'll shave them down again. So after that 3 to 4 weeks, sometimes they'll come back 2 months, 3 months. So sometimes it's just finding a good balance to kind of make sure it's comfortable for you. A lot of people don't have pain with the callus. They just know that it's there. Some people have pain and they do need it kind of taken care of. So padding and creams, shoes, orthotics, those are all important in treating it. Now, heel fissures, and this picture is a pretty serious version of it. Not everyone has it this bad, but heel fissures are dry, cracked skin around the heel. They can lead to bleeding. They can lead to discomfort and pain. A lot of times we see them in patients who stand a lot on their feet for work or for fun, patients with diabetes or hypothyroidism, patients that have skin conditions such as eczema or psoriasis are also prone to it. This patient here in this photo had excessive sweating, definitely all around the edges, and he developed a thickened tissue around the heels. Dry climates, we see it a little bit more. Also open heeled shoes, so flip-flops or sandals, slides, loafers with open heels. You're more prone to having that dry skin back there and causing heel fissuring. And obesity, the little bit of weight on the extra weight on the heel. Sometimes when patients start losing that weight, they're able to eliminate some of these issues. The treatment for the fissures on the heel is, it's still hyperkeratotic, the thick tissue, just like the corns, just like the calluses. A doctor may go ahead and clean it up and debride it down for you, shave it down and make it smooth. Creams, like we mentioned, urea-based, UREA. Those urea-based creams are going to go ahead and kind of help with that thickened tissue in that area. If you do have an open lesion there, or if it's bleeding, it is important to see a doctor. We don't want any infection to get in there at all. Avoiding open shoes can help decrease the abundance of the fissuring on your heels. And orthotics, and then heel cups. Heel cups are just a little gel that kind of comes in and cups the heel to take some pressure off of the heel. Pitted keratolysis is another people kind of think it's cool when they see it on their foot. Because it has little tiny pits, and the picture didn't come out too well, but it has little tiny like pits in the skin. Almost looks like little valleys that kind of picked up out of the skin. It's actually caused by a bacterial infection though, and you may smell a little bit of an odor. You may see that little pitting in the bottom of the foot. The foot sometimes may look moist or wet, and that's from the moisture from the sweating or not changing shoes. And then the treatment usually is a topical ointment to the area. Sometimes you need an oral medication. Usually, and the most important thing is changing your shoes and socks regularly. So if you're going to be in a warm, moist environment, or if you know that you particularly sweat a little bit more than someone else, it's super important to make sure that we're changing our socks and shoes throughout the day. That goes with changing the socks maybe halfway through the day, changing your shoes, maybe not wearing the same shoe every day, or changing it in the middle of the day. So that way you're not staying in that warm, moist environment. We see it a lot down here in South Florida because we don't get away from the warm, moist environment, but it is a bacterial infection. So we definitely want to see a doctor as well. Another very, very common thing is a wart. These are also called verrucas, and they're actually viral lesions, and they're caused by a strain of the HPV virus, the human papilloma virus. And it's actually caused by direct contact of, if the skin is compromised, you can pick it up almost on any public surface. So, or private service, but if you're sharing it with someone who maybe has a wart, these are pool decks commonly seen, locker rooms, mat in fitness classes. If you're taking yoga and you're borrowing a mat, or if you're in Taekwondo and you're using a mat and someone had a wart before you, you can pick it up. Showers and more. If you do have a wart on your foot, it's important to kind of bleach the shower after you take it so you don't pass it on to someone else in your house. Wearing shoes around the house, during the treatment. Warts can be painful, usually with direct pressure. So if we press directly on it, or if we squeeze it side to side, we can feel some pain. When you see a doctor, they'll kind of debride at the top and you'll see little black marks. And those are the pinpoint vessels kind of coming through. Those small black dots, we sometimes cause the wart even without the debridement to look at like it's salt and pepper in nature. You see these little tiny, and that's kind of the keystone of knowing it's a wart versus maybe a callus or a corn or a clogged sweat gland on the bottom of the foot. Sometimes warts do resolve on their own. Other times you do need a little bit further treatment, and the treatment usually consists of a couple different options. Freezing the wart, just like a lot of other lesions, they'll come in with cryotherapy, they'll freeze the wart. Applying an acid, it's called canthrone, or a blistering agent to the area, causes it to blister up and eat away at the verruca, the wart tissue under the area. Electrocautery, there's a new thing out now. It's called, it is microwave therapy. It's called the Swift treatment. The Swift treatment allows you to go in with a microwave. It's not a laser, it's a microwave, and it goes in and it shocks the wart and it starts a viral response within the body to treat the wart. Laser therapy, they are using lasers, and surgical excision if you should fail the other options. Some patients, the first treatment, the wart will be gone. Some of them do require repetitive treatments. It is viral in nature, so it does follow the viral load of the body. And so it's important to kind of treat it almost routinely. I'll see my patients usually about once a month, sometimes a little bit sooner, sometimes a little bit later, just depending on the wart. Very, very, very common is a fungal infection. This is also known as tinea pedis, or an athlete's foot. A lot of patients will come in, they'll have dry, itching, scaling skin. They usually will say that they've had it for a long time, or that it's just in the arch of the foot, or it's just between the toes. Sometimes patients don't even realize they have it until it's brought to their attention. Say, did your feet ever itch you? Oh yeah. Or have you noticed this scaling kind of on the bottom of your foot? And patients will be like, oh yeah, you are right, it has bothered me before. Usually, it comes from a more moist environment, humid. The shoes, like sneakers, closed-toed shoes, the most boots, everything we wear, they do encourage a fungal growth. So it's very important to kind of spray your shoes, change your socks. You want to be making sure that you're wearing moisture wicking socks, that they're not holding moisture within your foot, that your shoes are breathable. There are a lot of obviously work shoes and shoes that we can't kind of get away from, but that's why it's important to kind of changing the shoes and socks daily and throughout the day. Fungal infections can worsen. They can cause an infection within the skin as well. A lot of times between the toes, patients will see that it goes unnoticed because they don't check in between their toes, and that warm, moist area between their toes after a shower stays moist. That fungus kind of gets into the skin and it can cause an infection in the foot. So it is, although it's a very common thing, it is very important that we do get it treated. And we don't want any issues. Usually a treatment is topical antifungal. Your doctor can prescribe you something a little bit stronger than what's at the pharmacy, but there's a lot of options at the pharmacy, like Lotrimin. Some patients do oral antifungals as well. There are drying agents that can be put on the powders and other kind of sprays, changing the shoes and socks, wearing breathable footwear, like we said, wearing socks that moisture wick, keeping the shoes and socks sprayed. And then the same thing, this is kind of contagious, so we want to make sure other people in the house or that you're around don't get it from you as well. And the same type of fungus can affect the nails, and we look at fungal nails. Fungal nails are also called onychomycosis. That's the medical term for it. You can get fungal nails from a plethora of different things. Usually it's from trauma, some people from chronic disease, circulation problems, immunodeficiencies. You can blame mom and dad because some patients have a genetic susceptibility to it. And then what happens with the trauma is you bang that toe, the toe lifts up, and you've been exposed to the fungus has a route in and it makes its way into the toe. You may see thick, discolored nails. It may be brittle or maybe too hard to cut. It can go either which way. Sometimes it does have a smell to it. You'll see debris under the nail. You'll be able to kind of scrape at it, and in the nail folds, the nail might start lifting up. Those are all important things to kind of take note of. It is very, very common. However, a lot of times the treatment is done by a doctor. They'll debride the nail for you down. There are many different types of topical medications. The same thing, there are some stuff at the pharmacy that you can pick up. However, a doctor would be able to prescribe you something a little bit stronger for the nails, and oral medications for antifungal as well. The oral medication that is for the antifungal is processed through the liver. So a lot of patients stay away, a lot of doctors stay away from that. There's blood work to be involved, and you want to make sure you're not on other medications and that your body's kind of processing it right. So most people will start with a topical medication. You can have the nail completely removed. That is an option for treatment. Or laser therapy is also a very popular option for fungal nails at this time. It is, a lot of patients will say they've had it forever and they'll let it be. And a lot of patients want it treated right away. Nails do take about 9 to 12 months on average to grow out. So treating a fungal nail and trying to, with an antifungal is going to take time. It does take patience. I tell my patients, whatever they choose in terms of treatment, the topical, if they're going to be painting on this nail topical on their nail every day, put it next to your toothbrush, put it next to your bedside, put it next to the toilet, next to the shower, something you do every day. And I don't ask them what they do every day, and there's no judgment, but something they can work into their routine. So that way they can use it every day for about the 6 to 9 month period, so they can really treat that nail and get it to grow out. Some doctors will also take a biopsy of it. And that biopsy is awesome. It can tell you what pathology of the fungus it is, if it's resistant to certain medications, and it can tell you if it also has the thickening of the nail from trauma. So there's a lot, and it could use a urea, just like the UREA, the cream we talked about earlier. So there's a lot of different options for fungal nails. A lot of people say there's not, they just let it go, but definitely get it treated and get a look at. Some other nail disorders outside of fungal nails are ingrowing nails, which is also called as onychocryptosis. And pretty much what that is that the nail edges start to grow into the groove of the nail on the sides. It can cause inflammation, it can cause pain, it can cause a buildup of tissue in that area. Prevention of it really is making sure your nails are cut straight across. A lot of times people like to dig on the sides and cut down on the edges. That kind of causes the curving to push more pressure on the tissue. So we always want to cut the nails straight across. Your doctor may cut back in a different way than you would, but to prevent it, the cutting the straight across is important. We see ingrown nails. There is a genetic component to it, so we can blame mom and dad or grandma and grandpa again. But a lot of times it comes from improper cutting or wearing tight shoes or poorly fitting shoes. A lot of patients who are wearing the heels that kind of come to a point have a little bit more of an increase in it than a patient who's wearing a wide toe box sneaker. If you're a picker or you like to tear at things, picking or tearing at the nails can cause more pain, more inflammation. It can also lead to infection. So infection in an ingrown nail is also called a paronychia. And that infection is usually at the border where the nail is putting pressure on the skin. That can cause inflammation, redness. Sometimes you may see pus. You may see, you will probably feel a little bit of pain. You may see streaking of the redness coming up your toe if the infection worsens. And that is very important to see a doctor, so that way you can go ahead and get that taken care of. The treatment usually is removal of the offending nail edge border, and then whether it's a topical antibiotic or an oral antibiotic, whatever is needed for your clinical situation, that's how a doctor would treat your ingrown nail. Another common one that we see is what's called a subungual hematoma. So sub is under, ungual is the Latin root of nail, and a hematoma is that blood collection. So it's usually due to trauma in the nail, and there's a buildup of blood under that nail. Anything from dropping a TV on your foot to subbing it into or I shouldn't say we stubbed it into the couch jumped up at us and jumped into our nail, can cause the subungual hematomas. It usually will have to come off if it's greater than 25%. So the research shows that if the blood collection under the nail is greater than 25%, it should be removed by a doctor. if it's left untreated, it can lead to infections. The hematoma can sit there and brew infections just like anywhere else in the body. It could have a component of a nail laceration, the bed being lacerated from the trauma. If there's a fracture associated with it as well, that would make an open fracture, and you want to make sure that you get it treated pretty quickly. Some people will let these go untreated, and they will notice that they do lose the nail eventually, or they end up with an infection or lifting of the nail that causes fungus, and then they're dealing with that fungal infection that they're trying to treat for months on end. I will say that due to the trauma, this is also very common in runners or people who kind of wear their nails are a little bit long, or they wear shoes that kind of hit their nail. I would say though that due to the trauma, sometimes people expect the nail to grow back the same. The nail grows from back below, and it's called the nail matrix. And if that is damaged with the trauma, sometimes the nail will grow back thicker or irregular. Sometimes it grows back with a ridge the first time, and then that ridge is gone after that. Sometimes it will grow back with a ridge almost every few months on cue. So it's very hard to say whether or not it's going to grow back the same until we start seeing how it grows back. And like I said, the nail does take about 9 to 12 months to grow back. Another very common skin condition in the foot is psoriasis. So the skin usually is thick, silvery scale patches. They usually get dry and itchy. And psoriasis can actually affect the toenails. So a lot of times people think they have, fungal nails, and they may still have a component fungal nails, but they also have a history of psoriasis. And so it may be the psoriasis that is actually affecting the toenails rather than a fungus. And that's why those biopsies of the nail sometimes are important to take a look and see what the pathology of the thickened nail is. Treatment for psoriasis is usually steroids, sunlight, sun therapy, moisturizers, coal tar preparations, and then regular nail care and trimmings to the foot and ankle. A lot of times we treat this in conjunction with a dermatologist because you'll have those plaques elsewhere in the body. Another common condition is eczema or atopic dermatitis. Same thing, you see this itching and the scaling of the skin. A lot of times the cause is completely unknown. A lot of times patients will have a history of hay fever or asthma. So it's always important that we ask them what other is going on in their body. A lot of times people come in and they're here to see a foot doctor. And I start asking them about their head or their chest or their breathing or their heart. And they're just like, oh, this is my toe or this is my foot. But the whole body is connected together. So it's really important, all the doctors work together and that we kind of figure out what's going on, because a lot of times things are connected. The eczema is usually seen a lot of times behind the knees or in the arms, but it can really be seen anywhere in the body. You can see it here. This is on the top of the ankle. And the treatment usually consists of steroids and oral antihistamine for the itching, immunomodulators, and light therapy. Another common thing that we do see is pigmented lesions. Those pigmented lesions can be anything from a nevus or a mole. A nevus is just a beauty mark, the medical word for beauty mark. And it's just a cluster of pigmented cells that show up small, dark, brown in color. They can develop anywhere in the body. As you probably see, they can be on the shoulders, the knees, the toes, the legs, the arm, the stomach. And we see it a lot in the foot. Sometimes, as in this picture, you can see it actually under the toenail, and it causes a streaking of the nail. Most of the lesions that we do see all over our body are harmless, but in some cases they can be more serious and they can be cancerous. Bob Marley actually died from a melanoma in his foot that went kind of unnoticed. And a lot of times we go to the dermatologist and they do the head to toe exam. Sometimes the feet aren't the most commonly looked at because you're not looking at your feet every day or the bottom of your foot. So it's so important to still check the bottom of the feet. If something looks irregular, a lot of times we'll recommend a biopsy just to make sure that the lesion has no changes. What I mean by irregular, when we look at lesions, we look at the size of it, we look at the shape of it, we look at the color of it, we look at if it's raised, if it's changed a lot recently. So the doctor may recommend a biopsy, whether it's of the nail bed, as in this guy up top, or if it's a little mole or a little beauty mark that they want to say looks a little bit questionable. They want to make sure that it's nothing, serious going on. Like I said, most of these are harmless, but it's always good to stay on track of our body. Some other skin conditions that we may see are what's called epidermal inclusion cysts, and these sometimes present like calluses on the bottom of the foot. Just painful to walk, and the doctor would be able to shave that down for you. You may see, unfortunately, I see basal cell carcinomas, I see squamous cell carcinomas in the foot and ankle. So it's really important that we don't forget about our feet when we're kind of taking care of all of our skin conditions. And that's it. And I think we have a really good amount of time for questions, because I always know that you guys have a lot of questions, whether it's skin conditions or if it's just foot related in general.
Yeah, that was amazing. I didn't know that about Bob Marley.
Yeah, it's crazy.
Yeah, that's something. Well, Marilyn had a question. Is it painful to remove a nail due to toe fungus?
So I never sugarcoat this with my patient. There is an injection associated with removing the nail, and that's the most painful part. So the injection the injection goes into the hallux, this is the big toe. This is a very deformed foot too, so don't. But so the injection goes from here. It's called a hallux block, and they'll take the local anesthetic, which is if you've had dental work, Novik, it's usually lidocaine, Marcaine in the foot. And we inject it here and we numb the toe from here up. That is the worst part, I would say. There's no sugarcoating that. Usually, topical anesthetic on it before, little freeze spray. It's a 2-second kind of, oh, ow, like a needle. You feel the pressure kind of build up there. After that, it's completely, you shouldn't feel anything to do except for pressure with the procedure. When they remove the nail, they remove the nail bed and we pull the nail off and the nail bed is exposed. After that, usually what I have my patients do for the healing would be soaking it for about 2 weeks in usually Epsom salt warm water and just applying a little antibiotic ointment and a band-aid to it. And that's it. It will grow back. And if it's removed for a fungal nail, as it's growing out, it's really good to start treating it for the fungus. So that way we prevent it from coming back. So it's a lot of times people have tried everything and they just want the nail gone, or it's too thick or whatever it may be. And they do opt to have it removed for fungus. Some people have it opt to remove permanently, and that would be applying a chemical to the base to kind of prevent it from coming back again.
Okay. So Joan said she has flat feet, bunions, and she's over 80. Are there any options for me other than surgery?
So there's always options. I trained as a surgeon, but I always like to say that I like to exhaust all conservative care before surgery. So for the flat feet and bunions, the first line of treatment usually is orthotics, stretching, physical therapy, kind of getting you to a place where you're not having pain. I would say if you're not having pain, I always ask my patients first, are you having pain? I've seen patients with bunions like this, where they are completely out and around. And I say, hey, and they say, it doesn't bother me. I say, then you know what? We'll let it be. So it really has to do with a pain thing. If the flat feet and the bunions aren't bothering you, orthotic control, good supportive shoes, not walking barefoot, some stretching can really can prevent surgery. If it comes to a point where the pain is debilitating your life, then that's when the surgery conversation is had.
Okay. Okay. This question comes up all the time. It was chatting to me. Foot cramps. When one toe just goes like fully out, and just sticks, and it looks weird and you just can't get it back straight. But what can you do for that is the question.
So, and that usually happens at night.
Yes.
Because at the end, that's when everything has to happen. So you can't sleep. So usually a foot cramp is caused by overuse of a muscle group or dehydration. It can be caused by potassium or magnesium being a little bit off, and then also venous insufficiency. So usually in the toes, it's one of those. Making sure you stay hydrated all day long before you go to bed. And like we say every time, I know it's hard because we don't want to be getting up and going to the restroom all night long, but that's definitely something to kind of keep in mind, and making sure that all your vitamins and everything's kind of in check, and there's nothing going on vascularly as well. But that's the easiest you can do. Really stretching it out is going to be the one thing to alleviate it.
Okay, Jen, go ahead.
So I don't know if it's from wearing dark nail polish on my toes, but I think it's not the fungus. It's like white, and I mostly have it on my big toenails.
So
that-
yeah, so super, and I probably take off my toenail polish and show you, because I always tell my patients, do as I say, not as I do. In reality, you should be taking your nail polish off and letting your nails breathe every 2 weeks. Now pedicures, and when you go get a pedicure, it lasts a little longer than that. So you're not gonna, you kind of let it go the 3 weeks to 4 weeks. But you really should. Couple things in nail polish, you want to look for a lot of healthy nails polishes are out there now that don't have a lot of the formaldehyde or the negative effects on the nails that cause that kind of white buildup. Yes, that white buildup can also be fungus, but I see it a lot from when I leave my nail polish on too long, and I don't use that kind of healthy nails. A couple of good nail polishes out there are like Zoya, Zoya, Doctor's Remedy. Those are ones that have a lot of natural oils and kind of help prevent that like buildup. The darker the nail polish, I see the darker the nail polish, the more you may see the yellowing of the nail, especially with red or like black or navy. You may see the yellowing of the nail, but the longer it's left on, those little white deposits kind of stay on the nail. They should, if you take a file down and come off. If not, then they're deeper in the nail, and then it could be a little bit of fungus. It could be the dryness from the nail polish.
Thank you.
Okay, Positive Pat, go ahead.
Okay, good morning. How you doing?
Great.
What are some of the causes of neuritis in your leg, like from the knee down all the way to the foot? No numbness.
So do you have lower back issues too?
Yes.
So the nerves start in the lower back and they go all the way down to the toes. So if it's something that maybe when you're sitting or laying down, you feel more, then it could be lower back related. It could be lower back even if you have it all day long, but they do start in the lower back and go all the way down to the toes. Also, the nerves all have, they go all the way down. So they have little areas that have bony prominences, or sometimes a tendon or soft tissue vessels are kind of putting pressure on them, or you kind of get a little bit of pressure in that area and you feel that numbness from a certain level down. So the nerve may be either kind of not acting right from a certain level down and be more of a local entrapment. So the nerve is being entrapped locally. And then sometimes it is things like, neuropathy that's kind of creeping up the leg. If it's from the knee down though, is it positional when you sit or when you put pressure on it, or is it all the time?
It's not all the time. It comes and goes.
Is
Sometimes
it like a burning,
down
tingling,
as
numbness,
soon as-
shooting?
No, just the pins and needles.
Just the pins and needles. So when I have a patient comes in and we're talking about all that stuff, I tap on certain big nerves to see if they're like, oh wow, I feel that. Or if they don't, then we talk about lower back as well. The next step usually is kind of a nerve conduction study. And what that does is they test the nerves from the lower back all the way down to the toes, and they look at the kind of shocks and signals that the nerves are sending out. They're sending to each other and sending to the muscles. And they're able to kind of tell you if there is inflammation or damage to a nerve at a certain area, what route it's coming from, and whatnot. I will tell you that a lot of nerve, there are nerve medications out there and everything, but a lot of neurovascular patients, vitamin B is the neurovascular, B1, B6, B12. So a lot of patients will do well by loading up on a vitamin B2 to kind of alleviate some of that nerve discomfort that they have.
The lab work was fine. The B12 is up because I take B12 and vitamin D every day.
You take B12 alone. Okay, so a lot of times, and then a lot of the neurologists that I work in the area will load patients up on B1 when it comes to the nerves too. So if it's just the B12 and you're high because you get either injections or because you take the B12, then B1 is also neurovascular vitamin as well.
Because my doctor tried to say it's arthritis. Comes from arthritis.
So when we talk about burning, tingling, numbness, and shooting, we talk about nerves. Those are usually nerve related. And then when we talk about like throbbing and aching and stuff, they can go hand in hand with things like like arthritis, but if you're feeling, that's why it's important to have the exam and kind of really see like and touch like, oh, arthritis affects joints. So is it coming from a joint and then you're having the discomfort, or is it shooting down the leg or in a certain area of the leg? And that's why it's important to actually physically like have an exam, touch, you know, feel and do it that way.
Mm-hmm. Okay.
All
Thank-
right. Okay, and okay, so back to the chat. So Frank had a question. I have an injury to my Achilles tendon. Rest or stretching? Which one would you suggest?
So it depends on what your injury is and how long ago it happened. And
It happened 2 years ago at a
Okay.
yoga class, and I re-injured it trying to get out of a kayak with Grace.
that sounds like you're having fun though, yoga and kayaking. I may come hang out with you. Um, So
It's
have-
about 1.5 inches from the floor
that's where you feel it,
where the pain is. Yeah,
where the pain is. Have you seen a doctor for it?
no,
Okay, so the Achilles tendon is I like to think it's the most important tendon in the body because I obviously deal with it, but it really is one of the most important tendons in the body. And it comes down and it inserts right back here on the back of the heel. So when we're looking at this, if you have a little bit of a fat pad here, so if you're looking at it, you know, 1.5 inches from the floor, you're looking at the back of the insertion of the Achilles tendon. At the back of the insertion, it is very common to have like small tearing going on there. If you take a step, if you've been really tight and you take a step and it has little micro tears, if you got out of a kayak and maybe put a little strain on it, it could either be tearing, it could be inflammation. There is also a bursa that sits back here that gets inflamed. How long ago did it happen?
2 years,
Oh, 2 years from the kayak too?
1.5 years since the kayak.
1.5 years, and it's still bothering you?
Oh, yes.
Then I would definitely get it checked out by a doctor. Let them touch it, let them feel it. You know, x-rays show us bone. They don't show us soft tissue. So a lot of times a doctor will recommend an MRI to take a look at the Achilles or an ultrasound to kind of take a look at it. But if you're still having pain, discomfort, you've now become in this chronic state, and it's better to kind of get it treated than kind of, you know, do whatever. A lot of times though, you will feel better with a little bit of a heel lift, because when you're taking a step, you're not getting that complete pull of the tendon.
Yeah, I walk 1.5 miles just about every day, but it's not without pain. So,
So that sounds like a doctor needs to be seen by now.
okay. Thank you.
Of course.
Okay, so Bernice wrote in, I have a hammer toe that is causing pain. Have a Dynasplint, which I have not used for quite a while. Didn't really help. Any suggestions? Surgery is not really an option due to other medical issues.
So hammer toe. So hammer toes, there's a few different types of hammer toes, but to keep it simple, there's flexible, meaning that the toe is hammered, but when I pull on it, I can still stretch it out straight. Or there's rigid, which means that when I pull on it, it doesn't bend at all. It stays kind of hammered. A flexible hammer toe can undergo a procedure if in the office where you just kind of numb the toe, just like the big toenail removal. We numb the toe and there's a little tendon down below and they release the tendon and that's it. Sometimes people have one stitch, sometimes people have no stitch, and they kind of, you know, they wrap it up and you kind of go on your way. Otherwise, the hammer toe surgery, yes, is going in and breaking the hammer toe, resetting it. Sometimes people put implants or pins in it. Sometimes it's just stitched and splinted, but the hammer toe surgery is it's still a surgery and it's a big one because it's on your foot. But for conservative care, the most important options really are splinting. So you said you have the Dynasplint. It's going to hold it down and try to stretch it out a little bit. If it's a really rigid hammer toe, no matter what I do, it's, you know, it's not going to kind of budge because the bone is the bone and it's kind of formed in that way. You also have the option of wearing a crest pad, which is a little pad that sits right under, just to prevent any ulceration, to prevent any callus formation at the tip of the toe. There's not much, I mean, in terms of your, is this Bernice? In terms of your pain,
Yeah.
Bernice, is it bad?
Bernice, so you want to unmute? Hold on.
It's okay. So if your pain is bad though, and you know, you want to make it you want to make it accommodative. So you want to have the splinting, the padding, and everything you can do that way. Wide toe boxes, making sure your shoes aren't too tight and not putting pressure. I'm lucky in Florida, a lot of my patients in those situations can wear open-toed shoes, so they don't have a lot of that rubbing, a lot of that pressure in the toes. But there are some conservative options, and then based off the type of hammer toe, there may be options to avoid surgery also.
Thank you very much for your information. Appreciate it.
Of course.
All right. So Johnny asked, is walking barefoot around the house generally a bad idea?
Yes, I tell my patients not to walk barefoot in their house, to have a pair of slides or house shoes or slippers, something supportive. I grew up in Florida, so I'll be honest with you guys, I'm really bad at this. I walk around barefoot all the time, but I can tell you that the days that I remember to put my shoes on in my house versus walking barefoot, my plantar fasciitis acts up, my bunions hurt, like my pressure on my feet. I can feel the difference. I'm not saying that because I'm a doctor. Walking barefoot adds a lot of pressure to your foot and a lot of weight and pain and discomfort. It's awesome, great idea for so many reasons to have a shoe. It protects your foot. It protects you from stepping on things like maybe you dropped a glass jar 9 years ago and the piece just happens to find its way to your foot that day. It protects you from temperatures. It protects you from fungus. It protects you from all bacteria, protects you all that way too, but it also gives your body the support it needs and the protection it needs to kind of take those steps. So definitely something to wear around the house. I know it's hard now with COVID. No one wants to wear their shoes in the house. A lot of times they don't want to bring the germs in. They're very aware and heightened of germs now, but having a shoe at your front door or in your mudroom or at the back door, just slide on, wear around the house is a great option.
Okay. Barbara Scala asked, are bunions on the outside of the big toe and why do they develop?
So bunions, so there's the big bunion, which is this guy, which is outside the big toe. And what it causes is it causes the bone to kind of fall out and rotate. These sesamoid bones in the bottom start to fall into the middle. And then this guy you start to see that kind of angle on the outside. It happens due to biomechanical factors. So it's how your foot kind of wears over time. There is a hereditary component of it too. I do see some kids with some bad bunions that you can't say they walked on their foot for 85 years and developed, but they do develop and kind of change the shape of the bone. Some people have huge ones, no pain. Some people have spurring that needs to be shaved down. Ultimately, the first kind of treatment would be orthotics, stretching, conservative care. But a lot of patients do end up in surgery for bunions. The other type of bunion is a Taylor's bunion, which is on the outside of the foot, and that's on the fifth toe that kind of comes out and falls in. So that little bunion is almost the same kind of way. It kind of falls out and you kind of get the bump there. It can cause you to see a bump on the outside, cause calluses, pain, discomfort. So definitely something to keep in mind and be made aware of too.
Okay. So Patrick added, if he likes wearing Crocs, the most comfortable shoe to wear that he's for him, and especially around the house. Is that a good choice?
So I like that you're wearing shoes around the house. Crocs, I have a lot of patients that love Crocs. They're easy to clean. They do shrink in the sun. I learned that the hard way. But you can clean them. You can go outside in the rain. You can go outside, in the sun, and people can go in and out. In the house, they are an okay shoe to wear. They do have shock absorption. They don't have the best support though. They do have a wide toe box. They have a lot of positive things, but the support just isn't there. A lot of my patients who were Croc believers switched over to some other shoes that are kind of like the same material. It's called OOFOS, OOFOS. And those actually have a little bit of an arch to it, to give you a little bit more support. Because the Crocs have like, you kind of slide in and it's a flat bottom. They have that shock absorption. And they do protect your foot. But there definitely are some better options out there. But I like that you're wearing something around the house. And as long as you're comfortable in it, we don't want you to be uncomfortable in it either.
Yeah. Okay. So what about a Birkenstock?
Birkenstocks are very common. They're actually back in style now. Because everything comes around, goes around. Birkenstocks are great for a lot of different pathologies of the foot. They do have the footbed that kind of accommodates to your foot. It does take a little bit of breaking in, but it does kind of accommodate to your foot. And you also will have a little bit of arch support to them. They're all different styles now, so it's not like, but some are better than others, but overall the Birkenstock is a good option for your foot.
Okay. And Barb Bender said toes curling up like hammer toes, swollen, was told it was likely the result from back surgery. Also told she has plantar fasciitis and hard to walk, very painful.
So hard to say. It depends on how long. Well, it doesn't. But so what happens with hammer toes is there's 3 different ways that hammer toes kind of occur, and it has to do with which tendons overpower what little muscles and whatnot like that. So there's different types of way the hammer toes kind of occur. When you have something that we see very common with diabetics who have neuropathy, or people who have back surgery and nerve damage and stuff like that. The hammer toes are common type of foot type that we do see. They do start to kind of curl, and it just has to do with the activation and the activity level of those kind of toes. It could be due to the back surgery. It could not. I obviously didn't see before and after, so it's hard to kind of say. But with the toes curling like the hammer toes, the best thing to do is kind of start early with range of motion, kind of grab towels, grab some marbles, stretch them out. You can make sure that you're wearing good supportive shoes, arch supports, that you are, you can put a little pad called a crest pad. It's just CREST, just like the toothpaste crest under the toes to kind of keep them up and elevated. You just don't want them to get any worse, but unfortunately it is a very common thing that does happen from a lot of nerve related conditions. The plantar fasciitis being hard to walk to, stretching. I think I can send you the stretching packet again. I think I sent it once before. But if you shoot my emails at the end of the slide, I'll type it in here actually right now. I can send you over a stretching packet, and it will show you stretches for the plantar fascia, for your toes, everything like that. And so the one thing you want to do is you want to prevent it from getting worse. And so the plantar fasciitis, if it's been around shortly for a couple weeks, couple months, a lot of times doctors will do injections, cortisone, they'll do oral anti-inflammatories, arch support, stretching. Sometimes if it's not getting better, there may be tearing in the band. You may need more workup, immobilization, MRIs and whatnot. So definitely something to get looked at by a doctor so they can kind of pinpoint what's going on.
Okay, and Barbara E asked, she wears orthotics in her sneakers, but in the house she wears Easy Spirit sandals, which do have some arch support. Are these acceptable?
Yes. And it also goes to say, I mean, how, I would love to say I spend most of my time in my house, but I don't. But if you're spending a lot of time in your house, obviously, you want the best support for your foot. If you're spending time in and out, as long as you have something, it's better than nothing. We just want you to have support. We want you to feel good, not to kind of have any of those issues walking around the house. But the Easy Spirit, they have that little tiny like arch right in the middle. And as long as they feel comfortable for you, they are acceptable.
So another question, what is the best walking sneaker or shoe, or the most comfortable that would be arranged for mostly everybody?
Yeah. So the best like walking shoes, I will say a couple different brands, New Balance, Brooks, Asics. Those all have the opportunity to go wide, even like triple, quadruple wide. They have good toe boxes. Now it always varies in terms of the style of the individual shoe with the brand. But overall, those in terms of walking shoes, they always have a negative. I mean, they always have a strong heel. I'll take my sneaker off so you can see. They always have a strong bottom where I should be able to bend right here in the forefoot of my shoe, but I can't, if I try as hard as I can't bend it in half. And last lecture, I brought in bad shoes that I wear all the time that I could bend in half. And then a firm heel count. So the firm heel, meaning that no matter how much I squeeze this guy, it's still holding my heel in place. A lot of them you'll see they kind of squeeze in. This guy back here, it's holding my heel in place. That's really what you want to look for in like a good walking shoe, and making sure that it fits your foot, the size and the width of your foot. We do have 2 different sized feet. So you want to make sure that you try on the shoes on both feet. You usually want about like a thumb's width from the big toe to the front. You want to walk around in the shoes in the store. You don't want to just be like, hey, those look really pretty. I'm gonna put them on and I'm gonna go to Disney World and walk around 900 miles today. Really want to try to make sure that they fit your foot. Put them on. You want to go shoe shopping at the end of the day. Your feet swell as the day goes on. If you go shoe shopping in the beginning of the day, the shoe may not fit you as well at the end of the day. So the best is to go shoe shopping at the end of the day when your kind of natural swelling has kind of taken place and set in. So that way you can really kind of get a shoe that fits your foot. But Brooks, Asics, New Balance, those are awesome.
Okay. And is tea tree oil a good remedy for toe fungus?
So tea tree oil is definitely one of the natural remedies that a lot of people use for toenail fungus. The thought of that it goes in and kind of suffocates the fungal elements. I've had patients that have used tea tree oil and they've seen a result. It also depends on how the degree of fungus and like how bad it is. A lot of the topical antifungals now are adding tea tree oil and jojoba oil to the antifungal, to the kind of the chemical description of it. And so there definitely is some evidence that shows that it does help. Alone, I haven't personally seen that it's been like 100%. The good results I've seen have been very early on fungus with just like the nail tip, just a little bit, and they've been applying it on, kind of suffocate it, and it grew out beautifully. But a lot of times when we see these thick nails and they're putting the tea tree oil on, I haven't seen a complete eradication of it. Now, the best thing to be, and the insurance wouldn't like if I did this, would take a biopsy before and after and really see if the tea tree oil did kind of affect the nail fungus.
Okay. All right. What about what can I do at home for RA?
So rheumatoid arthritis, I'm assuming that's what you mean by RA, because for rheumatoid arthritis at home, really anti-inflammatories, keeping active. If you're not like in that state of inflammation and you're able to do, it's important. When it comes to rheumatoid arthritis in the foot, control is important. So like we talk about arch supports all the time. It really is, it's important to kind of control the arthritic joints. A lot of times patients will end up on, medications, whether it's long-term medications or short-term medications. What happens is in rheumatoid arthritis is that it's an inflammatory reaction within the joint, and your body's kind of attacking the joint lining. So the conservative care really is decreasing the inflammation. It is an autoimmune and an inflammatory kind of disease. And so if you're at home and you don't want to leave the house and you have no medication, it's just really kind of trying to keep it down. Now, a lot of rheumatologists or internal medicine doctors that you'll see for your arthritis will prescribe different types of medications for it. So it is important to kind of see a doctor and get treated for the rheumatoid arthritis to kind of prevent the progression of it from getting worse and worse.
Okay. Okay. Anyone else have any other questions for Dr. Kane? Anyone want to raise your hand? Dorothy?
Was she saying peach tree oil? What kind of oil?
Tea tree. So tea tree, TEA, like
Oh, tea tree.
Yeah,
Okay.
tea tree oil. That's like one of the like natural home remedies for nail fungus that is
Oh.
commonly. And I will tell you, I've heard everything. People put Vicks on their nail and they swear by it. I've seen Windex, and this is not medical advice. I'm not telling you to do it, but I've seen everything that people, they soak their toe, in peroxide 4 times a day. So everyone has their own thing, but tea tree oil is one of them that a lot of people do believe helps with the toenail fungus, and they have added it into a couple of different topical antifungals, so it has to have an element that it has a little bit of truth to it.
Okay.
Okay.
Thank you.
First,
Go ahead, Barbara.
Yeah, all my life I have calluses. It runs in my family.
yes.
Excuse me. And I have just about every gadget you can use for callus. Like, excuse me, after I shower, I have, well, the latest thing I have is like a little grater, like,
Okay.
and you pass it there when it's soft after the shower. But and then I have like a blade. I have a basket full of gadgets when I'm
You're
through.
doing it all.
Yeah, I use them all. But somebody told me the blade, when I use the blade, it causes it to grow back faster, and the grater is better. So I'm asking, what do you think?
Yeah, so in terms of the calluses, they form because of the pressure that we kind of put on our foot from the inside and then from the outside. So if you shave it down, it's not like it's not going to make it grow back faster, but in the sense of you shave it down, you get it nice, beautiful, and smooth, then you go out and you do your day-to-day, then you're building it back up because your body is trying to build that up to protect the same area. So it's not making it grow back faster, it's just that it's going back there. To prevent it from growing back faster, a lot of times, depending on, well, it doesn't really depend on where the callus is, but depending on where the callus is what shape of an offloading pad, but putting a little padding around the callus. So if you had a callus, let's say directly under the first big toe, a little pad that kind of has a curve there, so that when you take a step, the pad's absorbing some of it and the area of the callus isn't getting as much pressure. And then the creams kind of that do have the Keralytic, like I mentioned, Urea is over the counter, and it usually works awesome. And applying that cream to that area to kind of keep it down and at bay without kind of modifying the pressures on the foot, the callus will come back. So that means if we don't put padding or gel in an area, or we don't wear a certain orthotic or whatnot, then the calluses will come back. Another good commonly, so when we're tight in the calf muscles, we're tight in the Achilles, and then we're tight in this plantar fascia band. The tightness all along that whole route causes us to have a little bit more pressure to the forefoot. So even stretching can decrease calluses because of where you're kind of putting the pressure. So if you're getting calluses along the forefoot and the ball of the foot, by stretching the Achilles, by stretching the calf muscle, by stretching that plantar fascia band, we eliminate some of the pressure onto the forefoot when we're taking a step. We're not as rough on it. So we want to modify certain factors so that way we don't get the callus buildup. But by shaving it down, it doesn't make it grow back any faster.
Oh, I see. Because I also have very high arches, and someone said when you have high arches, you're kind of prone to that.
Yep.
So I'm always taking care of my feet. I mean, my feet and my face is my two pet things to take care of. And it's crazy, but it's a lot of time, money, and everything I spend to keep my feet looking decent, sort of.
Of course. And so when you have high arches, which is called pes cavus, and you have that big high arch foot, you put a lot of extra pressure in certain spots of the foot. And so you definitely are prone. And as we get older, that fat pad on the foot decreases. So then we get even more pressure. So you now developed a lot. So by putting some padding there, you kind of eliminate some of the pressure from the outside onto that area, and it should decrease some of the calluses.
Thank you very much.
Of course.
Okay, so Jenny asked, whenever I go to the nail salon, I get nail infections, so I stopped going. Am I super sensitive?
If you always get infections, I would say I would stop going too, especially if it's the same salon again and again. It may be the way that they're processing the instruments. So this is one of the very common things that I hear and I see: nail infections or even fungal infections from the nail salon. And they're like, well, they put the liner in the bin when they wash my feet. The fungus and a lot of the stuff actually sits in the filter. And so the liner does a good job in like protecting you in some way, but it also has to do with like the water being filtered. It also has to do with how they're sterilizing instruments. I can't speak for every nail salon, but those are always important things to kind of ask, like how often do they change the filter? How do they sterilize their instruments? Some nail salons now will allow you to have like your own instrument set. So that way it's kind of like if you're a routine patient there or a routine customer there, and you can kind of come in and take your own instrument set. But if you keep getting infections from the same nail salon, I would not go back to the same nail salon. If you may be super sensitive, they may be picking at the borders, they may be digging too much, they may be cutting you, and it can happen at any nail salon. It's happened to me as well. The one thing I do when I personally go, I don't let them, if I have a pedicure, I have them file my nails straight across. I don't let them cut. I don't let them like start picking at the cuticles. You don't get the full experience of it looking, as they usually looks, but it at least prevents you from getting some of those infections. Otherwise, you go to different ones, yeah. So I mean, it's a luxury. It is. If you keep getting infections and stuff too, the best thing to do is maybe go to the doctor and have the doctor take a look and see maybe why, if your nail's kind of cutting in, or if they're cutting it back too short, if they're cutting it down, if they're nicking you, whatever it may be. I wouldn't go to the nail salon if you just keep getting recurring nail infections. I would definitely get it taken a look at.
Okay, and best cream for dry cracked heels.
Dry cracked heels, a cream with your urea, UREA. You want a keratolytic, and I'll type keratolytic in the cream, and urea, and you want at least 20%. A lot of them maybe even 40% on Amazon and online. The urea, I will tell you that if you use that cream on like your hands that are like baby soft, they may turn red, you may have irritation. So that's really for like the dry areas and like the thickened areas and the skin like that. After you kind of treat that thickening, then we kind of switch to a different cream that's a little bit more sensitive, but that does a really good job at kind of eating away at the dry skin.
Okay.